Well, shocking visuals, but at this time, very few visuals actually shock. We wanted to put the picture out there where the district of Jalgaon in Maharashtra, which has the highest mortality rate across the country, and the situation and the condition of the hospital, Godavari Hospital. It is one of the key hospitals for COVID care in Jalgaon. Taking a look at those visuals, one can well imagine how bad things are. I want to now just shift your focus to Delhi. Delhi, till about 3 days ago, seemed everything was going wrong. Running out of beds, doctors on strike, not getting paid. All of that was coming together. But yesterday, the Home Minister, Amit Shah, met with the Delhi Chief Minister, Arvind Kejriwal, and they had a very constructive meet. And now it seems that Amit Shah is in charge. As Delhi continues to witness record surge in coronavirus cases, the Home Minister Amit Shah today took charge in the national capital, from holding an all-party meet to making surprise visits to Delhi's biggest COVID hospital, LNJP. Amit Shah is re-evaluating the entire COVID response of the national capital along with the Kejriwal government. It's not that they're at loggerheads. They're saying we're working together. Take a look at this report.
Home Minister Amit Shah in the driver's seat in Delhi. Inspecting capital's LNJP hospital, the nerve center of Delhi's fight back against coronavirus. The visit comes after the Home Minister took charge of the COVID war amid hospital chaos, rising cases and deaths.
Amit Shah here in the driver's seat. He's carrying out the review. This at a time where Supreme Court had come down very hard on the Aam Aadmi Party government for the mismanagement, calling the situation scary. But right here he is.
Shah has been holding back-to-back meetings with the LG, Chief Minister Kejriwal, political parties and top officials in the last 48 hours, rolling out key decisions to end Delhi's woes. Over lack of beds, hospital admissions, overcharging and slowing number of tests. The move will ensure a crucial price cap on private hospital bills. The centre will also give 500 rail coaches at Delhi's Anand Vihar station to add 8,000 additional beds and a big helping hand in the testing boost.
नई टेस्टिंग की विधि आई है जिसमें 450 रुपए में टेस्टिंग होगी और वो 15 मिनट में उसकी रिपोर्ट मिल जाएगी। लॉकडाउन को लेकर किसी भी तरह की कोई चर्चा नहीं हुई। वो अपनी ओर से कुछ लोग कयास लगा रहे थे।
ट्रीटमेंट की जो बात है, प्राइवेट हॉस्पिटल में हम और टेस्टिंग के लिए जो लैब मनमानी कर रहे थे, पैसे ले रहे थे अधिक, उनकी कैपिंग करने के लिए एक कमेटी का गठन हुआ है, जो कमेटी 2 दिन में रिपोर्ट देगी और उसके बाद जो पैसों में जो मनमानी थी वो समाप्त होगी।
As the ruling BJP at the centre and AAP in Delhi join forces, the Congress blamed the duo for the capital COVID crisis.
तकरीबन 3.5 लाख से ज्यादा लोग संक्रमित हैं, मौतें 10,000 के करीब हो चुकी हैं। दिल्ली में भी वैसी परिस्थितियां हैं। क्या ये दिल्ली के मुख्यमंत्री जी जिम्मेवार नहीं है? क्या देश के गृह मंत्री जी या देश के स्वास्थ्य मंत्री जी या जो एक अपील पर लोग देश के प्रधानमंत्री के साथ खड़े होते थे, क्या प्रधानमंत्री जी इसकी जिम्मेवारी लेंगे?
The pandemic may have forced political adversaries to come under one roof. Chaired by Amit Shah, the meeting has had all sort of political hues and ideologies coming together. But it is the ground situation which remains extremely worrying. But with Amit Shah being in picture, will things really change? That needs to be seen. With camera person Sanjeev, this is Kamaljeet Sandhu in Delhi for India Today.
So seemingly, it seems all agencies are coming together. The state and the centre, which have not been really on great terms, are seemingly coming together. Isn't that a good thing for Delhi? Many would say yes. On the other hand, if you just look at optics, well, it does seem that Amit Shah, the Home Minister, is taking charge of Delhi's COVID crisis. Does that put Aam Aadmi Party on the back foot? And the Congress in all of this raising questions on both the BJP, the central government, and the Aam Aadmi Party, the Delhi state government. I just want to cut across right now to our guest this evening. I have R.P. Singh, spokesperson, Bharatiya Janata Party. I have Rohan Gupta from the Congress, and I have Raghav Chadda, spokesperson, Aam Aadmi Party. Raghav, I'd like to begin with you. Now, somewhere down the line, do you think, if you look at plain optics of what we've seen today, you would have the Home Minister at a Delhi-run hospital with the highest bed count, 2,000. Optics-wise, do you think it seems to give out that the Delhi government is losing initiative and the Home Minister more in control?
Well, I think it doesn't seem to me as Delhi government losing initiative, but central government taking some initiative in the public health machinery and infrastructure in Delhi. I actually don't see this as a game of one-upmanship. This is a political. This is not a political fight, but a fight against COVID-19, and the state government as well as the central government are together in this fight. I think the controversy that was surrounding the LNJP for the last few days should now come to rest, simply because the Honorable Home Minister deemed it appropriate to visit the facility. He endorsed the preparedness of the government of Delhi, appreciated the efforts put in by the medical director as well as the doctors and staff of LNJP, and in fact in a closed door meeting said the following to the medical director himself of the LNJP. Number one, he said, please do not worry about what the media is reporting. He was very dismissive of the reports in the media. He himself said that I am very happy with the facility, very happy with the preparedness at LNJP. And he also said that the CCTV cameras that are now installed at every nook and corner of LNJP should be a model that we need to replicate in AIIMS, Jhajjar and other hospitals across the country. He was very, very appreciative, and I think we've received an endorsement from a political adversary, Shri Amit Shah, who is an ally in this fight against COVID-19.
Okay.
I think Raghav, for the first time you see...
Raghav, before I go to RP Singh and our other guests, I just want to ask you one very quick question. Number one, I'd like to correct you, not just media, it's the court, the Supreme Court. Had come down on Delhi government, not so much the media. The media was only giving out what the picture was. The second question, Raghav, I want to ask you, if you've had the Home Minister there, wouldn't optics-wise, and again, there's nothing, that should have happened or not, but maybe the Chief Minister should have gone earlier, because it seemed that the Home Minister now was in charge, which is a good thing, because it's sending out good, at least optics-wise, it seems that somebody's in control.
First of all, I was referring to one video which was an anecdotal evidence that was extrapolated by some parts of the media to portray a picture as if the entire health machinery in Delhi is collapsing. I wasn't referring to the Supreme Court. The Supreme Court did certainly make certain oral observations, but it has issued an order, issued a notice to us, and we will respond to the notice on the next day of hearing, and perhaps even include the endorsement received by the Union Home Minister and his appreciation towards the efforts put in at the LNJP. Number two, yes, he has visited, which is a wonderful thing. The government of Delhi has been working day and night under the leadership of the Chief Minister. In fact, as somebody who's working very closely with the CM on this project, I can tell you that the single biggest focus of the CM is to reduce the number of fatalities. The infection rate may go up because of unlock 1.0 and followed by unlock 2.0. But the most critical number to look at is the number of deaths, and I think that is the single biggest focus of the CM. He is working.
Okay, but you still, Raghav, I'd like to go to RP Singh, but you still didn't answer that question. That what if, shouldn't the Chief Minister have gone there as well, earlier possibly?
You see, one visit here or there, somebody visits and somebody visits after somebody.
Okay, no big deal as per you.
Doesn't make any difference in the larger scheme of things. The one message that it sends is that they're working together. Yesterday, the CM went to the office of the Home Minister when a meeting was convened by him. In fact, not just once, but twice, at 11 a.m. and at 5 p.m. in the evening. They're working in close coordination. Previously, we were accused of not working with them. Now we are being accused of working closely with them.
Nobody's accusing you of anything. Raghav, I think you need to... Nobody's accusing you of anything. I think it's fabulous. And I think most people who are watching this broadcast would think it's fabulous if the state and, if Delhi, the city, state and the centre have come in on this together. But, Mr. Singh, so with what Mr. Chadda is saying, huge endorsement by the Home Minister on how Delhi was managing after going to the LNJP hospital. Is that what we need to read into all of this? Mr. Singh, can you hear me?
Well, I can't hear, but I'm going by what I'm hearing on the TV. If he takes this endorsement, good, but let them take it forward now. No, I can't hear you. I can't hear, but I'm going by what I'm hearing on the TV. If he takes this endorsement, good, but let them take it forward now. No, I can't hear you.
Okay, we're going to sort this out. Mr. Singh, I'm going to sort this out with you. Our team is just going to figure your audio link out. But Rohan Gupta, is the Congress in all of this now going to actually say that, yes, we should all, work together? Or are you going to sit on the sidelines because you have no dibs in this and take political shots? Many would say cheap shots.
Preeti, first of all, let me tell you that Mr. Guru Mantri, Amit Shah, he is one of the leaders who took lockdown very seriously, the appeal of lockdown by our Prime Minister very, very seriously. We could not see him up to lockdown 4. As soon as the lockdown 4 was over and the Bihar elections were there, we could see him in virtual rallies. Preeti, I am from Gujarat. He is Home Minister, right? It is assuming that Gujarat is his home state. The situation is worst in Gujarat. 1,500 people have died. We have not seen Mr. Amit Shah there. And one more thing, like I was listening to you in your headline saying that now Mr. Amit Shah has taken charge and agencies are working in tandem. So were they waiting for 82 days to pass to do this? Were they waiting for 45,000 people to get infected in Delhi? Were they waiting for 1,400 people to die in Delhi to take charge? This is really not acceptable. Both Mr. Amit Shah and Aam Aadmi Party, BJP and Aam Aadmi Party, I think together they have made the situation of Delhi. We have, like if you ask people of Delhi, there is absolutely no facility. People are dying without having beds or without facilities. I think what they waiting for this situation to happen? And your program says that Mr. Amit Shah has taken charge. What are you talking? Were we waiting for 82 days for Home Minister to take charge of situation? The country was expecting, if Prime Minister was not available due to whatever reason, he should have taken charge of across the whole country on day 1 of the lockdown. The number of tests, now they are saying that we will increase testing we will increase testing in Delhi. What were they waiting for 82 days? Even now, Delhi testing is 5,000 to 7,000, and you are getting 2,000 cases. Okay. Just imagine if when the cases, when the testing becomes 20,000, what will happen to number of cases? So I think it's too late for government to. Even I'm really surprised and shocked to see this kind of headlines that now agencies are working together since Mr. Amit Shah has taken charge.
No, one second. It's not about being shocked to see these headlines. If the centre and the Delhi city state are coming together, it should be a good thing, Rohan Gupta, and it should be welcomed. Whether they can work together.
Shouldn't have waited for 82 days. That's my only point.
Okay, all right, point taken. Yes, Raghav, but okay, so Raghav, the question which is, so if you're a Delhi citizen, you'd see till, multiple reports, beds running out. You had your own deputy CM and your CM say that by the end of July, we are going to actually touch 5 lakh cases. All of that, the meeting happens with the Home Minister. The plan of action is not even announced by the Delhi government. It's not that the Chief Minister announced that what's going to happen. It comes from the Home Ministry, where a whole relay, a rollout of how beds are going to be increased in Delhi. So it does look that now it's the centre or Amit Shah in charge, which is, it's not a question, but is that what is the picture?
First of all, a meeting was convened and chaired by the Union Home Minister. And it's only fair that the minutes of the meeting or the important decisions that are taken in the meeting are articulated by his office and not by the government of Delhi or the LG's office of the Chief Minister's office. I think very critical, important, pertinent decisions were taken in that meeting. The decisions were taken in a spirit of unanimity. They were not, unilateral decisions taken by the union government. And with due consent of the government, certain decisions have been arrived at, which will now be complied. And both the state government and the central government will work together in implementing those things. You must understand, and you out of all people know this, since you've been covering Aam Aadmi Party for so long, that the constitutional scheme of things in Delhi is such that there are multiplicity of agencies, there are multiplicity of governments. There are 3 separate governments that operate and 3 powerful governments: the central government, the state government, the MCDs. And all these 3 governments also have their own hospitals and their medical facilities, from your AIIMS, Safdarjung and RML that fall under the government of India, to your GTB, Rajiv Gandhi and LNJP that fall under the state government, to your Bada Hindurao and various other hospitals that fall under the administration of the MCD. So, all 3 arms of the state need to work together to ensure that a robust healthcare machinery is offered to the people of Delhi in the COVID-19 outbreak. And I think that this is a wonderful sign of close coordination, where the Union Home Minister, after getting so many negative reports about LNJP, himself deems it appropriate to visit and gives an endorsement, a certificate of no objection to the Kejriwal government.
Mr. Singh is back with us. Mr. Singh, I hope you can hear me right now. And I again reiterate that same question. The Home Minister visiting LNJP, the Delhi government reading it as a massive endorsement on how the Delhi government has been handling the COVID crisis, correct?
See, let's understand. Govt is trying to take recuse under that there's a joint responsibility of the centre, the MCD, and Delhi government. There's a Delhi Epidemic Act which is there in Delhi, and Delhi Chief Minister is all in power to take whatever he want to do to save Delhi. And yes, we are saying that we are prepared to go to any extent to support Delhi. Delhi being a capital, we need to work it together, and then whatever support they need, because it's the duty of the state chief minister, the state health minister, health being the state subject, they need to come forward and do whatever they want to do. We will support them. And like we already said that we provide them 8,000 beds by the railway coaches, and then also that whatever ventilator, whatever oxygen beds or oxygen cylinders or oximeters they need, centre has committed that also. So we are prepared to take whatever let's provide this versus MCD versus the centre. I mean, that's bad. I mean, there are why people not scared of going to LNJP? Why LNJP hospital was still not being occupied? Even then, Home Minister went there to gear up the system, to tell the staff to gear up and then not to get let down by what is being reported, to start gearing up in future. Although the reports which are coming up from the LNJP was very, very, very horrific. But also, and on part of Raghav, you have been, I've been hearing you have been again and again saying MCD. On 11th of March, MCD has sent you a letter. I will send you a letter tomorrow on saying that you please take a facility of 890 beds of Balanjurao. It is 16th of this month that hospital has been taken now. So
what is he even saying?
Understand? Don't pinpoint and don't raise fingers. We are saying again and again, we are prepared to cooperate, and already one MCD hospital is already working.
Are we on the same debate?
Okay.
Are we debating the same topic?
Okay, 1 second. I just want to take final comments.
Come up, rise up from Slugfest. This is not election time for Aam Aadmi Party or BJP. This is COVID time. We need to fight it together.
Okay, I just want to take
you, folded hand to you and to your chief minister. We are there to support you all out. But
I think
get into this political slugfest.
It does seem that the Aam Aadmi Party and the BJP got the wrong memo of the meeting. I thought you both were going to come together and say we're both doing a fabulous job. I thought that was what was, the moot point to begin with today. But Rohan Gupta, instead of the Congress just sitting on the sidelines, it is a crisis. It's an unprecedented situation. Maybe, support what's going on. If there are two agencies, if the centre and the Delhi government are coming together and hoping to work it out, why point fingers right now?
See, absolutely, it's not a question of pointing finger. I'm just saying that whatever we are discussing today, if these headlines were there 80 days back, we could have saved Delhi from current situation. The way the BJP and the Aam Aadmi Party, they are just trying to do the blame game. That is not acceptable. It is a situation where you have to take responsibility and you are trying to come together after the Supreme Court's remark. And I'm coming back to Home Minister. His responsibilities across India, including in home state. The deaths in Gujarat are higher than Delhi. No comments. But I think the basic problem here is, Preeti, there is a question of will here. It is politics which plays above the people's health, and I think this is not acceptable. Governments have to come together. That's a good point. And as a Congress party, we did take up a campaign called Speak Up Delhi, where lots of people, when the LG was saying that we have given all the facilities, where CM was saying we submitted at least 100 videos to them, where the people were taking oxygen on road. They were not admitted. So the situation on ground and situation what these people are trying to portray, they are different, and Supreme Court has given befitting reply to both the parties. Please don't treat the patients worse than animals. And then they have come together. So I think it is
so Raghav,
they should have come together long back.
Okay, Raghav, quickly. I know you want to make a point. Quickly, come.
The way they are fighting on debate.
Okay, Rohan, you made your point. Raghav, yes.
Well, first of all, I could not understand what the BJP spokesperson was saying. I don't know whether he is on the same panel discussion or some other panel discussion. He's probably been misled about the topic of discussion. But I would again, say this and reiterate that these are times when we should not fight each other. These are times when we should come together and fight COVID-19. A very good initiative has been taken together by the government of Delhi and by the government of India. You see the Home Minister, the LG, the Chief Minister on the same page, and I think a lot can be achieved by working together. Today we are talking about converting Pragati Maidan into a facility, getting banquet halls and converting them into, I'm getting an echo, converting banquet halls into hospital facilities. You have the Home Minister visiting LNJP. I think a lot of good things are now happening in Delhi. Let's continue working together. We can, give politics a break for a few months. Once this pandemic is over, we can again come back to our politicking and score petty political points over.
All right, Raghav, fair point. Mr. Singh, that maybe, about a week ago, we were getting into this whole slugfest on how the Delhi government was not doing enough. But right now, it's the initiative of the Home Minister as well. Maybe come together on it. I think Mr. Singh can hear us.
I said
Raghav Chadda and Rohan Gupta. With that, it's a wrap on this edition of To The Point. But we do leave you with these visuals. As Chennai has gone into lockdown again, starting the 18th of this month. Delhi is saying there is not going to be any lockdown anytime soon. We are going to look at unlocking. London has now unlocked shopping. London seems to be getting its life back together. People were seen venturing out for shopping as United Kingdom allowed shops to open after 3 months of lockdown. People queued up outside department stores. Markings are seen outside stores to ensure social distancing. Shops were closed since March 23rd, and people so far were shopping digitally. But now it's all open, however, of course, with new normal shopping norms. My colleague Lavina Tandon filed this report. Most stores don't allow you to actually touch apparel until and unless you're quite sure you're going to pick it up. So window shopping is pretty much out of the window here. Listen into this report filed by my colleague Lavina.
I'm here at Oxford Circus, the haven for shoppers, and if you can see behind me, people are returning here to shop, and what a beautiful day to be out and about, and especially the first day that people can shop finally for non-essential items here in the shops physically. Otherwise everything was happening online, and the shop Oxford Circus is little bit, let me show you, getting its buzz back, though there are a lot of systems that have been put in place. For example, you can see there's only one exit and then there is entrance from another place. All the shops have done their own arrangements to secure the people and to make sure that they remain safe and social distancing measures are followed. And a lot of police are actually doing the rounds as well. Each shop, for example, Selfridges has put forth a lot of people not only to welcome with a smile, but also to make sure that they follow everything. They are getting water, they are getting, it is a beautiful day, but it's hot and sunny, so they are getting water and they keep hydrated. And I can see a lot of people coming back. There's a lot of media attention as well on the street to see how people are coming back and shopping and enjoying it. One thing that I have noticed, that there are more smiles than masks. There are more people who are just happy to be out and about after 3 months, more than 3 months of remaining in lockdown, and a lot of the time under strict.
It's good to see that things are opening and things are slowly, or some things are slowly coming back to normality. So yeah, it's just a quick thing and then back to work.
Yeah.
There's more focus on the distance.
Yes.
So when you're on the escalator, you have to keep distance. When you come in the store, distance. There's a lot more hand sanitizer.
Try on trainers as well. No try on clothes, so you've got to buy it.
Okay.
So you can't really try it on.